Well, hello, everybody. Welcome back to another week of HeartBrief, brought to you to give you three new and interesting articles that may make a difference in your practice, maybe in your own personal health. I'm Joel Kahn, medical doctor, triple board certified cardiologist, practicing in Detroit and southeastern Florida, obviously still in my southern office, clinical professor of medicine. Let's get to the interesting studies, all right? We'll see if we do this right. We're going to look at magnesium and its role right now on blood sugar regulation. So certainly it's common to say that all supplements are just expensive urine, and we can get magnesium from lots of whole food plant-based eating, nuts and seeds particularly. But what about supplemental magnesium? How many randomized clinical studies are there? Not enough. So here's one recently, February 11, 2026, Frontiers in Nutrition. Oral magnesium supplementation improves glycemic control in older Chinese adults with prediabetes and hypomagnesemia. So they did pre-select people that their blood work showed low magnesium. A randomized double-blind controlled study. Originally 71 adults, average age 69. Only 65 completed the randomized study for 4 months. They had prediabetes. They had low magnesium in the blood. And they either got 360 milligrams a day of magnesium oxide or they got placebo. Now, many of us would not choose magnesium oxide, one of the poorly absorbed versions of magnesium, and would have preferred a chelated magnesium for better absorption. But this is what that was done. And what they found, there must have been some absorption because the magnesium supplemented group did significantly increase their plasma magnesium levels. That's good. And they reduced their fasting plasma glucose. Of course, that's good too. There was not a statistically significant difference in HOMA-IR, a measurement of insulin resistance. There was a trend, but it didn't reach the proper p-value. It was a relatively small study. No difference in the hemoglobin A1C, insulin C-peptide, and other inflammatory markers over 4 months. So in conclusion, in older adults with prediabetes and a low magnesium level, magnesium supplementation effectively corrected the deficiency and reduced fasting plasma glucose. So what do you do with your next patient, which is like 3/4 of them that have some evidence of hyperglycemia, insulin resistance, prediabetes? You should consider checking their blood magnesium level. I tend to do a red blood count, RBC magnesium, but a standard magnesium is fine. If you do supplement, please choose something like magnesium glycinate, magnesium taurate, magnesium malate, as we think these are better absorbed, and maybe, only hypothetically, the results of the study would have been a little more powerful with a version most doctors that use supplementation would have chosen. Okay, let's go to the second study, also quite interesting, which is from a journal ACS Omega, published just recently, evaluation of long-term administration of proton pump inhibitors in mineral nutrient bioavailability. And this was an animal study. Also we have to always ask about its translation to human health. But there has been plenty of data that short-term proton pump inhibitors for acid production reduction certainly have a role, but long-term, chronic, are there consequences? And there's been reported concerning findings, and I discuss these with my patients. In this particular study, they did reveal the potential for a suppression of blood count, red blood cell, and other production with long-term use of PPIs in this mouse model. And then they also found changes in mineral fluxes, mineral imbalances, particularly iron, copper, and calcium. And what's concerning about this study is it struggled to find out the mechanism of why proton pump inhibitors chronically may have an adverse effect on an animal model, but it's been reported in humans, is the concern that there is pretty clear data that chronic proton pump inhibitor therapy may make people more prone to osteopenia, osteoporosis, maybe through this calcium metabolism pathway described in this animal study. And of more concern in my field as a cardiologist is data that Chronic proton pump inhibition may impact endothelial function, may worsen endothelial function, and put people at risk for cardiovascular events. A higher rate of heart attacks has been reported in people on a proton pump inhibitor. So I actively work to get people off proton pump inhibitors. It might be weight loss, might be change in diet, getting rid of dairy, getting rid of gluten, putting them on some natural substances, slippery elm, marshmallow supplements, glutamine, and they usually can do quite well. But I work in conjunction with the gastroenterologist. The last paper is a certainly provocative and important one. Journal American Heart Association just published prevalence and trends in cardiovascular risk factors among middle-aged South Asian adults compared with other racial and ethnic groups in the United States. They took the MESA study, multi-ethnic study of atherosclerosis. They took the MASALA study, Mediators of Atherosclerosis in South Asians living in America. They combined them and they focused at the group that were 45 to 55 years old. They found that at age 45, individuals of a South Asian background had a higher prevalence of prediabetes and hypertension compared with white, Chinese, or Hispanic citizens of the United States. They also found at age 55, there actually was more likely to have a diagnosis of diabetes in the South Asian group. That all of this led to calculations of increased risk of cardiovascular disease in South Asians, which is well known. So this was a large study involving thousands of patients coming from good and well-respected databases, focusing in this age 45 to 55 range, and leading us to appreciate that we may have a special group in our practice. Some of you listening to this are South Asian descent yourself. And in this group, we need to be even more meticulous about proper lab work. I would advise proper screening at age 45, like a coronary artery calcium CT scan would be a good idea at a very low cost and high safety. And identifying people from this background that may be at risk that aren't obvious just from routine evaluation. So 3 important studies, one on magnesium, one on proton pump inhibitors, and one on a high prevalence of risk factors in South Asian Americans. Hopefully, these can help you hear from HeartBrief, better care for your patients, advise your patients, and maybe even in your own life, be healthier too. So we'll be back next week with some new and hopefully interesting papers. Have a great week.